the one that I was involved in as it was going through preclinical, was the same molecule was there for pediatric and adult binge, as well as pediatric, adolescent, and adult ADHD. So, I don't think, going to your initial question, I don't think companies are investing or going to invest in, quote, the binge drug, like that one molecule that just does binge. But I think what the finding is that in that CNS space, there's different molecules that exist that might have potential to be in play for this binge eating disorder.
Right. Okay. That makes perfect sense. I guess, so I think you touched on it there, but, understanding is that there are some drugs that are being used in these patients right now, including some FDA-approved medications. I guess, do companies right now, again, I'm just speaking broadly, from an industry perspective, do companies continue to see an unmet need with the current range of medications that are available, and where do they see the unmet needs currently?
Yeah, I think companies see the unmet need because of the revenue potential, because it's really not a binge drug. However, I think the market as a whole, I still think there's some work to be done on the payer side to actually have, these drugs covered fully. And this might have changed, but the last research I saw, and the last time I interacted, which is probably a good year ago for reference, maybe even 18 months. A lot of my psychiatrists weren't, I mean, some went as far as didn't accept binge order as a disorder. Okay. But a lot of them, I would still say 50% of them, weren't ready to jump on the bandwagon and treat it with a pharmaceutical solution.
Right. And are you able to see what the specific concern on their end was? Was it, and I think you may have alluded to just not seeing it as a disorder, or not having certain criteria being, certain established guidelines for diagnostic criteria? Is that really?
I think it's both. I think it's both. I think there is a segment of the HCP population, psychiatry population, that doesn't truly feel it's a legitimate disorder. And then for those who do, because there isn't really a gold standard and treatment guidelines in place, they're going to err on the side of sending someone to like a clinic and, more of a mind, body, soul type of equation, because they do believe it's in their head. And I think that's, I know enough about the space to be dangerous, but I always ask when I was having these conversations with folks, I think the disconnect is also between major institution and community regional institutions and physicians. Like the Mayo Clinic has this real big effort around binge.
Right.
But you go into some, smaller healthcare systems, and you go into the regional community hospitals, and they're like, well, it's not really a disorder. It comes from, other, mental problems. A lot of it stems from poor self-esteem. If you can control your eating pattern, like